Hello and welcome back to the Dental Realist Podcast. We're excited to be back. We've been gone for a little while and we're back and better than ever now. So I am Dr. Ryder Waldron, and let me introduce Dr. Marcus Neff and Dr. Troy Stevens. Marcus, how's it going tonight?
It's going all right. I made it through another day of dentistry, and we even had some snow on the ground this morning. Slowed down my drive.
Wow, feels like spring here, so that's good to get some snow.
I guess. I'm ready for spring.
Well, Troy, how are you doing tonight?
Doing well. We got a little skiff of snow over here this morning as well, Marcus. It wasn't too much, maybe not quite a half inch, but It all melted off because it hit like 40. I think it's like 40s this afternoon.
Yeah,
so
it's all
good.
Pretty much gone.
Yeah, I hate winter. That's pretty much why we haven't been podcasting, is because I hate winter.
Troy's been hibernating. He doesn't like winter, so he just goes into a 2-month hibernation.
I can't talk. It's too cold.
Well, Troy, you were kind of bragging to us this afternoon that you completed the composite gauntlet. Do you want to tell us anything about that? You were kind of showing off today, chatting up about dentistry.
I don't think that's what I wasn't trying to show off at all. I just got so focused on doing so many composites, I couldn't picture myself doing anything else.
Man, yeah.
You just get someone numb and you just basically fix every surface in their entire life.
Yeah, I think it was more you were happy you survived because, we love those when you get like 4 posterior teeth and you go MOD, DO, or whatever. I don't know. And that is a chore.
Oh, all those bands and
wipes you out.
and wedges. And,
it does wipe you out.
It's very, very strenuous.
Yeah, it's a lot of margins and everything to keep clean and dry and filled. And Well, we usually try to give people some real-world advice on this podcast, whether you're a dentist or a dental student, and I think tonight is no different. We've got a couple of cases that happened, mostly to Marcus and Troy in the last couple of weeks. So, Marcus, do you want to start and tell us what happened with the salesman at your office recently?
Yeah, so 3 or 4 weeks ago, maybe it's been not quite that long anyway, a sales rep came in to visit me, and this is a guy that I really respect, and I really like him. He's a good guy. But I've been working with him for a lot of years, but he came in with a laser rep, and I can't even remember the name of the laser. But anyway,
it's a sophisticated heat beam we call a laser.
Yes, that one. It was interesting. The guy was bald and he had a scar, and he kept putting his pinky up to his face. I don't know. No.
Did he want you to refer to him as doctor instead of mister?
Exactly. Yes. Dr. Evil.
Yeah, interesting.
Yeah, exactly. Did he have a little cat with him?
He did. Matter of fact. It was really odd.
Mr. Bigglesworth?
Yes, the one and the same. Well, he came in and this new laser, I guess it's not terribly new, but supposedly it's just the latest and greatest laser. It's the most amazing laser. This one can truly cut all tissues. Hard tissues, soft tissues. It's quieter than other lasers. It can do, you can do fillings, you can do frenectomies, there's pretty much nothing you can't do with this laser in dentistry. You don't even have to use anesthesia. He went on to tell me about the amazing results they're seeing. There's a few doctors in my area, of course, that are using it now, and they're having great results. And that makes me start, the wheels are supposed to start turning in my head that, well, dang, if other people in this area are using it, that means my competition's getting a leg up on me. I should probably have one. Anyway, after talking about it and showing me a video on it and all these things, and saying that they'd like to bring it in and bring me lunch and bring the laser so we could try it out, probably on some hot dogs or something, and then we'd eat the hot dogs after.
Because it cooks them.
Yeah, you can see how it works. Then we'll bring you lunch, we'll bring the laser. Well, I ask, how much is it? Oh, it's only $100,000. That's it.
Sure.
Oh,
yes.
That's on sale.
$100,000. Well, I've been around this stuff long enough, and I've done my share of buying stuff based on the recommendation of a rep. I bought CEREC initially when I probably wasn't really financially in a situation I should have done it, and I loved it. The technology was amazing, and I loved it. But the reality was, it is that CEREC, for me, I didn't have the volume of patients. It wasn't, and I still love it. And I use it actually today. But some of these technologies, you've really got to step back away from, get some distance from the rep who's in there hyping it, from the excitement you might even feel about the technology, because maybe you love technology, and you really got to sit back and look at it and think about, how will I really use this? Will I really use it? Is this going to make life better for me and for my patients? Is it going to really have a positive impact on my bottom line? Or is it really just going to be an additional expense that's draining more money from my account? Those are some of the things that pass through my mind. And anyway, those are some initial thoughts I have on that.
Yeah, so my initial thought with this is, yeah, it could improve your life. It could make things better for your patients. But when it really comes down to it, it's got to make you some money or save you some money. So if it's not, it's tough to be in business if you're out of money and you don't, whether you love your patients or not, and it made dentistry better, it just doesn't seem to help. So, well, Troy, I guess my question for you would be, do you feel like dental sales reps are out of touch with real life dentistry?
I think that they know what's going on. I just think that they do what they do to all of us, is they come in and hype you up, and they make you think that, you're kind of doing inferior dentistry if you don't have this technology. I get that all the time with the CEREC and the E4D. Our rep's been trying to sell us one of those for years. And, it may work for some people. It's just that, the reality is, in order for me to, like you were saying, you have to bring in enough cash to justify $100,000. Well, am I going to do enough frenectomies that's going to pay that $100,000,
Yeah.
Or, am I going to do enough restorations? Say I start doing class 2s with this thing, and then, that takes a whole bunch of class 2s to pay back $100,000 when I've already got the equipment to do it now.
Yeah.
Right? So.
Oh, but they'll tell you that you don't have to use anesthesia with your drill. You've still got to give them anesthesia. And who likes the sound of that drill, Troy?
Yeah, the question I have for them is, how do you drill into someone's dentin and not have sensitivity?
It's the magic
I don't care
of
if
the
it's a laser or not.
Yeah.
I know, but what are they doing? How are they getting through that?
I wonder that too, Troy. How does... I don't know. I have people... So you're telling me that...
numb the tooth?
Yeah, you're telling me cold water hits this tooth and it makes it sensitive, but a freaking laser won't?
Right. Yeah, you got those people that you actually have to cover the opposing arch because they go water flying around, it's driving them crazy.
Yeah.
But you can hit them. You can hit their dent with a sophisticated heat beam we call a laser, and it's just going to miraculously, And I may be wrong. Maybe it does some kind of a numbing effect on the tooth.
I don't know.
But even if it
But when you stop using it and air hits that thing, when you try and dry the thing when you're doing your composite, it's going to send them through the roof.
Yeah.
Well, my teeth are really sensitive.
Yeah.
I know. And, I think these salespeople, like the guy that came into my office, I've known him for years, and I really do respect him, and I think he's a really smart guy. But his job is to sell me something. That's like literally his job is to sell me things. So even if he's not trying to pull one over on me and scam me, he doesn't know the ins and outs of where I work. He doesn't know the financial situation of my practice, or, he doesn't know any of that. All he knows is that this thing, he may even genuinely think it's going to make life better for me and it's going to be a good business decision. But he doesn't know. He doesn't have access to my financials. He doesn't work with my accountant and me and planning these things out, nor would I recommend that with anybody. And so I just think you really got to step away from the excitement of things and whatever they're trying to hype and sell you, and really take a hard look at it and say, can this really make financial sense? And I think for a lot of these things, the numbers just don't add up. And
sorry, Marcus.
Go ahead.
I was just thinking, just off the top of my head here, with the PPO world that we're living in now, and our fees are decreasing, how on earth are we going to pay for this kind of technology in the future? Because they don't give, the insurance doesn't care if you're cutting the crown with the prep with a laser, with a drill of any sort. They don't care. you're still going to get $25 for it.
Right.
So, you can bill all you want. You can bill thousands of dollars for a class 2 because I just bought this new laser and that's going to how I'm going to pay for it. Well, the insurance is going to say, well, that's okay because we're only giving you $25. So you got, you have to take that into consideration when you're looking at this world that we live in now with the PPO domination. You can't adjust your fees to incorporate some of this stuff as you would. You're going to have to basically incorporate new procedures and cross your fingers and they're going to pay themselves off. You're still going to have to do a whole bunch of frenectomies to pay $100,000 back.
Yeah.
Okay, let me ask you this, guys. How many frenectomies have you done in the 14 and a half years we've been out of dental school?
What's 0 plus 0 carry the 0? That's still 0.
I did one last month.
Did you?
Yeah, I did do. I've done a few. I don't know the number, but I have a BioLase soft tissue laser that I use it occasionally for that kind of stuff, and it's so rare.
Yeah. I've done less than, I'm guessing probably 2 to 3, less than 5. And, I just take
But if you bought that laser, you'd do them on everybody.
Yeah. And like, how ethical is that? Like, okay, I haven't done one in the last 5 years, but now I have to do 6 this month because I've got a new laser. Like that's stupid.
Yeah.
And,
That's the thing that I don't
I
like
usually
about
just,
it too.
I use my lightsaber. It cauterizes well. And it's, that's all you need.
Yeah, that's all you need is a good lightsaber.
If you're even like me, you just use the Jedi mind trick. You don't have to do anything.
Yeah, you don't even need anesthesia.
No.
You
or
have,
nitrous or anything
you
like
have
that.
had a frenectomy.
Yeah.
I've had a frenectomy.
Your freedom is now gone.
I also don't send a lot of patients to a periodontist for like crown lengthening. I can't remember the last time I did.
Yeah.
With
rare.
implants and things like that, if you've got to have endo and then crown lengthening, build up in crown, sometimes it's kind of a lost cause with that much treatment on a tooth. I don't know. I don't do that much. So
yeah, I think sometimes with this amazing technology and some of it, you get caught up in thinking, maybe this is my ticket. Maybe this is going to be the thing that's going to make dentistry more fun, or it's going to be. I'm going to use it. You can almost talk yourself into it, but you got to be realistic. I mean, if it's a procedure you just hardly ever do, or the types of procedures you do with this laser are things you rarely do. I mean, are you really going to do them because you have a laser?
Yeah.
Or are you just going to
do
have
you
this
think
thing
that
and not
people
do it?
will flock to you, based on the fact that you advertise this laser? So the guy that down the road that doesn't have this laser that the people love are just going to miraculously shift over to your office because you have a laser.
Yeah.
Okay, that's a good question. Yeah. Because you would have to get some more patients coming in to pay for this piece of equipment. But when it comes down to it, in this frugal society we're in now and PPO-driven society, they're going to go, they don't care if you have a laser or not, they're going to go pretty much to the cheapest office. There might be that one here and there that will come to you that doesn't mind paying a little extra. But I think that would be tough, don't you guys, to get new patients in there just because you have an expensive laser, I think.
At least from my patient base, it would be
Yeah.
my patient base will walk down the street if it's $3 less.
It's true. Yeah, it's definitely true. Yeah.
But the salesman will tell you that that you're going to attract patients just by having this technology.
Yeah.
They'll
and
just
that
flock to you.
And that patient that's walking down the street to save $3 is walking down to another office that has a laser in it.
Yeah.
Yeah.
I don't know.
Yep.
So I don't know. Is there anything that would convince you guys, if I was the salesman, that I could say that would convince you guys to buy one of these?
No.
Me personally,
For
I
me,
don't think
no.
so. Yeah, I don't.
Yeah.
I don't think so. I mean,
Yeah.
maybe if they were doing a 2-for-1 special. I mean,
You could have one in each hand.
exactly, one in each op. Then I would have to be a little.
This is the sad reality. I mean, I think we have all been through the good times and maybe some of the good times of dentistry, and now we're into the bad times, of course. But back in the day, when we were out of school for 5, 6 years, we had the cash flow in my office that we could have done something like this. We could have expanded. We could have bought CAD cam or something like this. Now, no way. I mean, we're looking for places to cut every chance we get because every time we get our new annual fees from the insurance company, they're always less.
Yeah.
Yep.
And so like we've talked in previous podcasts, my income is going down, not up. And until my income makes a turn, I don't see myself going too hog wild and bringing in some of these really expensive technologies. I mean, yeah, digital technology, digital radiography, things like that are already in my office. Yeah, I'm going to continue using that stuff. But like the new things, the lasers, the CAD cam, I don't foresee it.
Yeah, because you already have equipment, like you said, that does that exact same thing, and it's paid for. An $800 handpiece can do the same thing as a $100,000 laser.
Right.
I think, but
exactly.
And I don't
use it over.
To me, $800 is less than $100,000, if I'm not mistaken.
I mean, you went to dental school. You've got the degree.
Yes.
I'm not a mathematician. Matter of fact, I didn't do very good in math at all.
Luckily, there was no math in dental school.
Well, we had to count to 32.
Oh, that's right.
Yeah.
That's right.
I barely passed that.
Well,
yeah,
you passed.
I mean, it's the reality of it is just until the practice starts booming, you start feeling like, you're starting to have some cash, it's just not going to happen for me personally. And this is my practice. I'm not speaking for everybody. This is my practice.
Yeah, I don't think it would work in mine either. We've talked about that supply fees with whoever your supplier may be, they go up every 6 months to a year. Lab fees are going up every year. Our reimbursements, our pay is going down. So just logically, it doesn't make sense to be taking out a loan for $100,000. And I'm guessing, Marcus, I don't know what he told you, but I'm guessing this loan was spread over just like 5 years or something.
I didn't get into the details of what kind of financing they'd offer, but I'm sure that's pretty typical.
Yeah.
5-7 years probably max.
Amortized.
Yeah, so $2,000 a month. I mean, that's a lot of crown lengthening, frenectomies, Class 2 composites.
Yeah.
I don't know.
And I don't think it's like any faster. I can't imagine that it just.
Yeah.
You got to still be able to control the thing, and that was another thing that I was like, I'm so used to using a drill.
Yeah.
And you get that tactile feedback. Like, how would I vaporize tooth structure with a laser and know that I'm like getting
that's
to
a good point.
I mean, I'm sure it can be done, but that's another thing. There's always a learning curve with this stuff. There's probably some seminars you need to attend. So it's not just the purchase of the equipment. If you want to do it right and you want to do it well, you're going to go spend money traveling to somewhere for classes and seminars and training.
Yeah.
And so there's additional costs that come with this stuff.
Yeah, what if that thing got loose in the mouth and goes shooting all over and leaves laser burn? I mean, I don't know. Well, should we move on to our next topic?
Let's do it.
So, Troy, you had this is the first I've ever heard of this happening with an insurance company, but I'm sure it's not the last time we'll hear about it. But why don't you tell us what happened at your office with a recent insurance claim?
Yeah, first time it's happened to me too. That's why I had talked to you guys about it to see if you guys had ever experienced it, because my business partner and I were like, what? So we had the first ever crown rejected for a root canal tooth. The reasoning being was the fact they said that the root canal was not to the apex. And so they do not cover crowns on teeth that don't have root canal to the apex. Now, I want to say that this particular instance, actually, I actually agree with them. There was some stuff that I would have probably done different. However, I have seen numerous root canals that have no periapical lesion, have no symptoms, nothing, and they are short of the apex. Like, I'm talking like 5-6 millimeters short, or even like half the root. You've seen those ones where they had done 30-40 years ago and the thing was calcified, and so the dentist went down about half the root is all he could get.
Yeah,
and they're doing just fine. So the thing that got me was the fact that when is it now to a point where the insurance company is now going to dictate previous treatment on the tooth to determine future treatment? So, like this situation, are they going to now say, okay, now we have to go back, not only do I have to tell this patient, okay, I know you're not symptomatic, I know that you haven't had trouble with this root canal that's been there for 20 years, that needs a crown on it, that should have had a crown on it 20 years ago, of course, but now am I going to have to go back to that patient and explain to them why they need to go have a root canal done again, even though they're asymptomatic and nothing's wrong with it? And that's worrisome to me, because the way we were trained, you do a root canal, you get a crown. That's what you do.
Yeah, right.
And in this situation, the lady had a root canal in the military, and they just did a massive amalgam core buildup thing, they tend to last quite a while, but it was starting to break down, so she needed a crown on the tooth. Well, now the insurance is saying no, so now I have to say, well, sorry, lady, your insurance is apparently deeming that you don't need this, and so either you're going to have to go back and have this root canal redone to satisfactory terms for your insurance to cover your crown, and that's also additional cost.
Yeah.
So, it's nuts. That's. I mean, this is the world we're getting into. I think we're going to see more and more of that.
Yeah. There's a lot of things that seem wrong with this picture. But Marcus, what are some of what's like your initial reaction, and what negative repercussions can you see coming from this?
I just think it's just another way that the insurance is interfering with the doctor-patient relationship. I mean, it just further erodes the trust that you need to have between the patient and the dentist. The patient has this benefit, whether they've purchased it or it comes from their work, their job, and they have an expectation that it's going to help with their dental costs. But then when it doesn't, and the insurance is telling them, no, we're not going to cover that, it just forces the patient to make some tough decisions, and further forces the patient to have compromised care. I mean, what are you going to do? Like, the patient legitimately needs a crown. You, the dentist, you've actually done an exam there. You have the discussion with the patient about the risks of restoring the tooth in the condition that it's in, with the root canal short of the apex. The patient determines they're willing to take the risk, but now you've got this third party in there, and they're saying, we're not willing to take the risk. We're not willing to put up money. I mean, it's just one more instance of dental insurance just really destroys or breaks down that relationship, and it's really not benefiting the patient in the end, in this instance.
Yeah, I mean, like you said, Troy, it does go totally against what we were taught in dental school, and the trust issue, Marcus, is big also because, a lot of times patients will hear what the insurance will and will not pay for, and they go with what the insurance is going to pay for because they trust that insurance better. They'll see their fancy commercials on TV about how much they care for your family and whatever, and then they aren't doing what is actually necessary for your tooth and your own health care. And that, oh man, it's a slippery slope.
I'd be interested to know,
really,
would the patient get a benefit if they went in and had the root canal retreated? Would the insurance pay for the retreat on that, or cover the portion of the retreat?
Well, and I wonder who is claim in. Like, sometimes, we know there's no dentist that actually looks at this. Sometimes it's just some insurance claim expert, and then it gets into the area of practicing dentistry without a license. And I wonder if that could be.
I wonder how much that happens. I would hope that it doesn't, but I wonder if it does. If it does, that's malpractice, and they should be sued.
Yep.
There is no reason for them to take this out of the dentist's hands. That's what we're trained for, I mean, that's the reason we went to dental school.
Yeah, and I can think of instances when I've called insurance companies when I've just been fed up with things they have denied and asked to talk to the dentist that's on staff, and they've put me on hold, and they come back and say, yeah, we're going to cover that, because I don't most of these insurance companies, I really don't think they have dentists that are actually looking at this stuff and looking at an x-ray of a root canal and saying that is short, or I think you mentioned, Marcus, that the actual anatomical apex may be different than what is shown on the x-ray. And
yeah, I mean, it's probably not 5 or 6 millimeters short, but what are you going to do if, say, you send in the x-ray, it's 2 millimeters short?
Yeah.
And you did the root canal and your apex locator and your x-rays, everything verified that that's where the apex was, I mean, but the insurance is going to deny it, even though the tooth's asymptomatic, and they're going to deny covering the crown.
Yeah. Yeah.
It makes no sense. It makes no sense. It's almost like, how do you fight that? I mean, as a dentist, when we're taught in school that when tooth has a root canal, it needs a crown because of it's going to be brittle, it's going to fracture, matter of time. And I mean, you're just almost like your head spinning. Like, okay, do I just need to start sending in pre-authorizations for everything so I can just make sure that you guys are okay with this?
Yeah.
I mean, it's like ridiculous. It's absurd. I mean, I think it was Gordon Christensen one time says he thought that there would be a time when we would actually have to take intraoral images after we've gone through to the class, like a class 2, and take pictures to prove there was decay there.
Oh my gosh.
Dude, give me a break.
Oh, man. Yeah, and I think you mentioned, Troy, that we're getting to a point where we might have to actually send in pre-authorizations for fillings and stuff like that. Yeah. And, like, I'm wondering, if a patient comes in for a toothache and they need a root canal, are we going to have to say, sorry, buddy, we can't, do anything about that tooth. We'd love to open it up and get you out of pain, but we can't because we've got to pre-authorize this. So if you could just stick it out for about a month, then we can take care of it.
Yeah.
I mean,
kidding, right?
It's unbelievable.
It is unbelievable. Hey, do you want to hear another one? Just happened to us today in our office. Business partner had this one happen to him. He has a person come in, has a very large existing restoration that covers a cusp, okay? So that, in essence, in dental school says, yeah, this tooth is totally is crown worthy.
Yeah.
They declined it because it was not fractured and did not have caries.
Yeah.
So have you guys ever heard that? Did you guys learn in dental school that if you have a large filling that covers an entire cusp, it's okay to not crown that because if it's not fractured, it has no decay?
Well, what we were taught is if you break a tooth off and break a cusp off, that's a crownable offense, I guess you could say. And so if you have a big enough filling that replaces that cusp, then yes, that is a crownable situation. And
because it's going to fracture again.
I mean, studies show that you get anything that's wider, a wide isthmus.
That lisp is coming back.
Yeah, right? It's really paying off. That speech therapy. I mean, we've talked
2/3 intercuspal width.
Yeah, we've talked about having, a big MOD. Sometimes that's not even a good situation to be filling a big MOD. It's just better to crown it, and you'll get a better long-term situation. But yeah, I don't know. This is nuts. Some of this stuff.
It's just getting so out of hand.
Yeah, and I just, the insurance companies, if they don't trust what we're doing, then don't let us be on your insurance plan. If you think we're scamming you on everything, which there are dentists out there that do that, we all know that. But get to the bottom of those guys that are doing things unethically. Don't punish everybody for it. It's just it's a bad look, and it seems to be just a way for them not to pay for stuff. And
yeah,
yep.
And the patients sometimes don't see that side of it. They think it's just us trying to get money out of them. I don't know.
Yeah. And it's a lot easier for them to talk to people on the phone and just push them off to somebody else because they don't have to see them face to face.
Yeah.
Where, we talk to them face to face. And interestingly enough, the insurance companies have successfully made it sound like we're the bad guy.
Yeah, that is interesting because, yeah, it's our business. Most dentists are business owners, or at least in small group practices or whatever, and it's our business. They are a big insurance conglomerate, and they don't have any face-to-face interaction. They just, whatever is cheapest, whatever their company sells them, they're going to buy. So I don't know. I don't know what to say, guys. We've talked a lot about this on some other podcasts with debt and with insurance stuff, and I don't know. We just keep coming back to it. It seems like in different forms.
Yep.
I don't know.
Yep.
Yeah.
It's just going to keep getting worse and worse.
Yeah. So
I mean, it's just going to get more and more. They're getting their nitty gritty hands into everything.
Yeah, and we're not getting paid for it either. I just don't understand it sometimes. I think that insurance companies are, well, I think they're extremely unethical, but they'd probably say otherwise. But who can do something about it probably is the ADA. So we really wish they'd step up and do that, get that taken care of.
Yes.
Yeah. I'm just disappointed that it's come to this. I mean, we knew it was coming because medicine had this happen to them. How many doctors can't even run tests now unless they have some uncreditable reason they need to run it.
Yeah.
I mean,
Or they
we knew it was
over-test.
coming, but it seems like
Yeah.
we didn't do anything about it.
Or it leads to running more tests than you need to, or doing more procedures than you need to, just to cover your butt and satisfy some insurance, or to hopefully, prevent a lawsuit or something like that.
Yeah, and I spent a couple years ago, that I saw something on the news about doctors, surgeons overdiagnosing things so they could actually, do something to make money. And it was, I don't know, minor surgeries, but, scaring people into doing stuff. And I think, I believe that happens in dentistry all the time. Like, of course it probably happens in medicine. So, it's on the practitioners to not do those types of things, but it's also the insurance companies to, make sure they're paying for what they should be paying for, and not kind of screwing us over, because at some point it's going to affect, I think, people's health care, because you're going to have the smart people not going into medicine or dentistry or they're going to find other avenues to make money, and you're going to have the dumb people that are doing surgeries on you and stuff, because they can, they can get into medical school now. So I don't know.
Yeah, at some point it's not, it's just not worth it. You look at all the headaches and hoops you got to jump through, and you start thinking, man, I've gone into all this debt, student loans, and all this stuff to have to jump through all these hoops and do all these things just to do a little bit of dentistry. At some point it just isn't attractive to the type of people that you want in the business.
Yeah, student loans are getting higher and pay is getting less, but whatever. We're just here to help everybody out. Hopefully we've brightened your day with this discussion.
Well, we've enlightened their day. We'd definitely just say what's going on. That's why we're here, just being
it's
real.
True.
Being real.
Being real. It's true, because like that salesman with Marcus, he probably came in and painted a real rosy picture with that laser, and we don't feel like people are getting the honest truth about some things, so that's what we're here to do. And a lot of consultants will come in and tell you certain things and promise you all kinds of stuff, and we just want people to realize what's going on out there. So we feel like we do that.
That's the thing is, it's not that I don't believe that any dentist would actually say, I do not want the technology in my office. Yeah. I would love to have CAD. I'd love to have all the radiographic, wonderful, cool MRI stuff they do, CT scanners, all that. I'd love to have lasers and stuff. It just comes to a point where you go, okay, can I afford to do it?
Yeah.
If the answer is no, then I can't.
Yeah, it's still a business.
It's still a business,
yeah.
and I can have all this fancy stuff and have nice boarded up windows in a few years, or whatever. I try to stay in business. That's my plan.
Yeah, and it's true. Your patients need you and they like you, and Troy, your patients love you, but
well,
Well, do you guys have any other parting words of wisdom before we wrap it up tonight?
No, that's been stuff that's been on the mind here lately.
Yeah.
Yeah, we bring some real world situations. So, well, Marcus, do you want to tell everybody where to find us and like us and love us?
Yes, Ryder is in Syracuse, Utah. And,
Whoa.
No.
Give him his home address.
And his cell number.
Yeah. Call him on the weekends. He likes to.
Yeah, if you call him, 6:45 on a Friday is a perfect time.
No, we have a couple of books out. So You Want to Be a Dentist and So Now You're a Dentist. Both are available in digital format. You can find them where fine books are sold. And the first book is in print format. So You Want to Be a Dentist is in print format. You can find that on Amazon.com, places like that. Get you a print copy if you'd like. We do have a Facebook page. We've also got not Instagram, but what's the other one? I'm
Twitter.
Twitter.
Yep. The face chat and the Insta.
Wow, we are old.
Yes. Social media.
That's right. You can find us on the interwebs. You can send us an email at dentalrealist@gmail.com. We'd love to get your feedback, any questions you might have, any way that we might be able to help you. We appreciate all of our listeners, and we really enjoy doing this podcast and sharing our perspective with you.
Yeah, we do. If you can't tell, we actually have fun doing this. We actually get along real well and have a good time. So, yeah, if there's any topics you guys want to hear about or want to hear us discuss, then let us know. And then we will see you on the next episode of the Dental Realist Podcast. Thanks for joining us.